Hi everyone, I'm Lindsay.
And I'm Bethany.
Today we're going to talk to you about domestic partners and whether or not they need to sign up for Medicare Part B.
So in this situation, we're looking at how domestic partners are covered. So if someone is on an employer group health plan as a domestic partner, when they become Medicare eligible, most of the time you have to enroll into Medicare Part B. You don't necessarily have to enroll into a Medicare plan, but Part B is typically required. If you don't enroll, what happens then is you don't have primary coverage. Medicare will be primary, the employer plan will be secondary. This does apply even if you're covered on a plan for an actively working employee that has over 100 employees. Typically, they don't have to, but if you're covered under domestic partner, the law says that you do have to enroll in Medicare Part B.
Which what's interesting about that, though, is what we have found is it really depends on the company. So I think it's important that you understand what it says for your specific benefits, because just because that's the law, you can override that and choose to continue to be the primary payer for that individual. But I've just seen people come up with a lot of questions because of that. It's just not necessarily something that's clear.
Yeah, so I think what the message we want to bring to the table here is if you are a domestic partner on an employer group health plan, check with that plan's benefits to find out if you do have to take Medicare Part B. But in most situations, have that as your default to be taking Medicare Part B.